Welcome to this discussion on practical, person-centered approaches in dementia care. Today, we're diving into the transformative power of creative arts.
Exactly. Often, individuals with dementia are perceived as beyond help, but we believe creative arts can reintroduce humanity into their care. And these approaches are accessible to a wide range of professionals, not just specialists.
Let's start with person-centered care. This approach, championed by Rogers and Kitwood, emphasizes the individual's needs and preferences. It places the person at the heart of care, not just the illness. It's about seeing them as individuals first.
Absolutely. And creative arts therapies, like dance movement psychotherapy and voice movement therapy, are incredibly effective. The key is non-intellectual creativity.
Could you elaborate on that?
Certainly. Creativity stems from an intuitive, non-rational place in the body and mind. This allows us to connect with individuals regardless of their cognitive impairment. It bypasses the limitations of rational thought.
So it's about tapping into something deeper.
Precisely. Creative arts can stir feelings and memories, reaching below the conscious level to access what we call hidden depth memory. It's about providing a space for emotional expression, whether those feelings are from the past or present.
And what about the individual's sense of self?
That's crucial. Despite memory disintegration, the yearning to belong remains, as O'Donoghue noted. Maintaining a relationship with the inner core, the core or heart, is essential, especially when rational faculties are failing.
So creative arts serve a dual function.
Yes, they link individuals back to their identity and the core of their being, helping them stay afloat during these profound changes. It's about reminding them and us of their inherent worth and humanity.
Let's consider the profound yearning to belong, a fundamental human need that persists even as dementia progresses. O'Donoghue's work highlights this beautifully.
Absolutely. And it's through creative arts that we can tap into this yearning, offering moments of connection and recognition that transcend cognitive decline. Think of it as a lifeline to their core selves.
Precisely. Now, the concept of the inner home is crucial here. Even when rational faculties are failing, maintaining a relationship with that inner core, the cœur or heart, becomes essential.
It's about nurturing that sense of self, that inner sanctuary, when the external world becomes increasingly confusing and disorienting. Creative arts provide a pathway back to that inner home.
And this leads us to the dual function of creative arts in dementia care. It's not just about providing activities, it's about linking individuals back to their identity and helping them stay afloat during changes.
It's like providing an anchor in the storm. By engaging in creative expression, individuals can reconnect with memories, emotions, and a sense of purpose that may otherwise be lost.
Consider emotional expression. Providing a safe space for individuals with dementia to express their feelings, whether from the past or present, is paramount. Creative arts offer a non-verbal outlet for these emotions.
And it's important to remember that these emotions are valid and real, regardless of cognitive impairment. By acknowledging and validating these feelings, we can foster a sense of dignity and respect.
Let's delve into how case studies illuminate the effectiveness of creative arts in dementia care. These aren't just abstract theories, they're living examples.
Exactly. These case studies showcase how creative arts facilitate communication and promote well-being. It's crucial to remember that all names are pseudonyms, protecting the anonymity of the individuals involved.
One key aspect is witnessing. This goes beyond simple observation. It involves observing bodily, emotional, imaginative, and interactive responses during the creative arts process. It's about being fully present.
And that presence requires self-reflection or reflexivity. We need to be aware of our own prejudices and attitudes towards the person with dementia. Freeing ourselves from these biases is essential.
There's also dementia care mapping, or DCM. It's an action research intervention that incorporates the perspective of the person with dementia to improve care. You can find more information at www.brad.ac.uk/health/dementia.
DCM uses systematic observation to code behavior, both positive and negative, providing a framework for personalized care plans. It's about understanding the individual's experience.
Finally, there's creative listening. This isn't just hearing, it's listening with your body and heart. It implies a lack of division between self and others, fostering a deeper connection. It's about truly understanding the person's inner world. Let's delve into dementia care mapping, or DCM. It's not just about observing, it's an action research intervention. Think of it as a structured way to improve care by truly understanding the perspective of the person with dementia.
Exactly. DCM uses systematic observation to code behaviors and environmental factors. These observations are then analyzed to identify areas where care can be improved to better meet the individual's needs. It's about making care person-centered in practice, not just in theory.
And that leads us to creative listening. It's more than just hearing words. It's about listening with your whole being, body, and heart. It implies a connection, a lack of division between yourself and the person you're caring for.
It's about empathy in action. It's recognizing that communication isn't always verbal, especially with dementia. It's about tuning into nonverbal cues, emotional expressions, and the underlying needs being communicated.
So, how does one actually do creative listening? It starts with self-awareness, recognizing your own biases, your own preconceived notions about dementia. These can act as barriers to truly connecting with the individual.
Absolutely. It's about being present, being open, and letting go of those reductive judgments. It's about creating a space where the person with dementia feels safe to express themselves, however they can. It's a continuous process of self-reflection and adjustment.
Witnessing in creative arts goes beyond mere observation. It's not just about seeing behaviors, but truly perceiving the individual's emotional and imaginative landscape.
Exactly. And to do that effectively, self-awareness is key. We need to recognize our own judgments and biases.
Reductive judgments, as they're called, can really limit our ability to connect. Our personal associations might cloud the other person's creative expression.
So, congruence and transparency become essential. By letting go of those preconceived notions, we move closer to the person with dementia. It's almost a person-centered meditative process.
It's about overcoming the barriers that dementia creates in relationships. Cultivating heartfelt openness, being emotionally available, addresses that deep sense of aloneness.
This approach aligns with care of the soul, investing in their emotional and spiritual well-being. It's also related to authentic movement, influenced by dance movement psychotherapy.
And let's not forget the felt sense, Eugene Gendlin's concept. It's about tuning into the body's awareness, a crucial element in person-centered practice. Let's discuss congruence and transparency in dementia care. Congruence in this context means being genuine and authentic in your interactions. It's about aligning your inner feelings with your outward expressions.
Exactly. And transparency builds on that. It involves being open and honest with the person, explaining what you're doing and why in a way they can understand. This fosters trust and reduces anxiety.
So, how does the person-centered meditative process fit in? It's a technique to help us, as caregivers, overcome the barriers that dementia creates in our relationships. It involves self-reflection and mindfulness.
Think of it as a way to clear your mind of preconceived notions and judgments. By focusing on the present moment and the individual's experience, we can create a deeper connection. It's about being fully present with them.
It's also about recognizing our own emotional responses. If we're feeling frustrated or impatient, that can affect our interactions. The meditative process helps us manage those feelings and approach the person with dementia with more compassion.
And remember, it's not about emptying your mind completely, but rather about creating a space where you can truly listen and understand. This allows for more meaningful communication, even when verbal communication is limited. It's about heartfelt openness.
Let's explore how we cultivate heartfelt openness in dementia care. It's about being emotionally available, addressing the profound sense of aloneness that can accompany cognitive decline.
Absolutely. This connects deeply with care of the soul, as James Moore articulated. It's investing in the emotional and spiritual well-being, recognizing that dementia affects more than just cognitive function.
Exactly. And this is where practices like authentic movement, influenced by dance movement psychotherapy, come in. It's about facilitating nonverbal expression, allowing individuals to connect with their inner selves through movement.
Can you elaborate on authentic movement?
It's a process where individuals move spontaneously, guided by inner impulses, while a witness observes without judgment. It allows for the expression of emotions and experiences that may be difficult to articulate verbally.
That makes sense. And how does felt sense, as promoted by Eugene Genlin, play into this?
Felt sense is about cultivating awareness of the body's internal sensations. It's a way to access pre-verbal intuitive knowledge. In person-centered practice, it helps us understand the individual's experience from their internal reference point.
So it's about tuning in to the body's wisdom, even when cognitive abilities are diminished.
Precisely. By combining heartfelt openness, care of the soul, authentic movement, and felt sense, we create a space where individuals with dementia can feel seen, heard, and valued, fostering a deeper sense of connection and well-being. Let's discuss the activities themselves. It's crucial to understand that in person-centered creative arts, the activity is a vehicle, not the destination.
Exactly. It's about facilitating a creative process. Think of it as a chemical reaction. The activity is the catalyst, but the real magic happens in the interaction and transformation.
So, what does this process look like? It involves stillness, a deliberate slowing down. This isn't about filling every moment with action.
Stillness allows for deeper listening. It's about witnessing quietly, observing without judgment. This is where self-awareness becomes paramount.
Consider it like this: the activity, A, plus stillness, S, plus witnessing, W, equals the creative process, CP. So, A plus S plus W equals CP.
And the creative process is where the individual with dementia can reconnect with their inner world, express emotions, and find a sense of belonging. It's not about the perfect painting or the flawless dance.
It's about the journey, the emotional expression, and the human connection fostered through the activity. The activity is merely the spark.
Think of it as providing a safe space for exploration, where the individual feels empowered to express themselves without fear of judgment or failure.
Ultimately, it's about honoring their inner world and facilitating a process that brings them joy, comfort, and a renewed sense of self.